Good morning, and thank you for attending. Today, Shannon Mantha, Executive Director of Clinical Services and Chief Nursing Officer, will provide an update on our local COVID-19 situation, and Andrew McClellan, Director of COVID-19 Immunization Strategy, will provide an update on our vaccine rollout. Before we proceed, I'd like to take a moment to acknowledge that the health unit resides on land covered by the Robinson-Huron Treaty of 1850. This land is the traditional territory of the Anishinaabe people. This land is also part of the unceded territory of the Algonquin Nation. I'd also like to acknowledge the Métis historical presence in this region. Indigenous communities and organizations have been instrumental in carrying out the vaccination program to their population and ensuring a community-driven public health response. We want to thank our Indigenous partners in their continued efforts to reduce the spread of COVID-19. The Health Unit Surveillance Team is currently reviewing vaccine uptake across the district. Using this information, vaccine strategies are in development to help reach people facing different barriers to accessing the COVID-19 vaccine. As part of this strategy, we have canceled COVID-19 vaccine clinics with extremely low appointments scheduled for next week. Instead, we have started a targeted approach to reach people who have not yet received their vaccine. We have offered walk-in appointments at many of our COVID-19 vaccine clinics, and yesterday held a walk-in only clinic from 5 to 8 p.m. in West Nipissing. If you're thinking about getting your vaccine but have questions, I encourage you, please call the health unit at 1-844-478-1400. The COVID-19 vaccine has proven very effective at preventing serious illness, hospitalizations, and death. As gathering numbers increase, it is important to continue to protect yourself and those you love by becoming fully vaccinated and continuing to consider the risks when gathering with others. Over the last 2 weeks, we have seen impacts of the gathering in large groups while not vaccinated and not practicing physical distancing. At the beginning of the month of July, most cases could be linked to a small number of social gatherings, but in recent weeks, we are seeing further spread to close contacts of those cases. This has a ripple effect across the district. One of these COVID-19 cases also tested positive for the Delta variant, and we suspect more cases will test positive for the Delta variant. 5 of these cases were children under the age of 12 who could not be vaccinated. Our children have been through so much since the beginning of the pandemic, including interruptions to in-person learning, not being able to see and play with their friends, and pauses in their extracurricular activities and sports. The last thing we want is for them to get sick with COVID-19 or to worry about their parents becoming ill with COVID-19. It is up to us to be vaccinated to help protect them. Remember, you must consider the risk before you gather, as the impact of your action goes well beyond you. And with that, I'll pass it over to Ms. Mantha to provide us with an overview of the COVID-19 situation.
Thanks, Dr. Chirico, and good morning, everybody. In the last 7 days, we've had 23 new cases of COVID-19, which brings our total case count to 650 across the Nipissing and Parry Sound districts. 468 of those cases have been in Nipissing district and 182 in the district of Parry Sound. At present, the health unit currently has 29 active cases. There is currently 1 active case that is tested positive for a VOC. This individual has tested positive for the Delta variant, as Dr. Chirico referenced. In total, 13 cases in our region, including 9 within the Nipissing district and 4 within the Parry Sound district, have tested positive for the Delta variant. Some new cases are still awaiting further testing. And currently, there's 1 individual who is in hospital due to COVID-19. As Dr. Chirico mentioned earlier, we have seen an increase in cases across the Nipissing district. Many of these cases are in the West Nipissing area. 82.4% of cases reported in the last 2 weeks were close contacts of individuals who have tested positive and acquired the virus in various social settings. Almost all of these individuals, 94%, were not fully immunized. The impact of COVID-19 extends far beyond just the individuals who test positive. For each individual that tests positive, all of their close contacts are required to self-isolate, which may mean they miss work, they can't attend childcare or school, they can't participate in extracurricular activities or spend time with friends and family. Additionally, if household members of those high-risk close contacts are not fully vaccinated, they also have restrictions and are only able to leave their home for essential reasons. I think that really these statistics drive home the point that social gatherings that include individuals who have not been vaccinated, they put everybody at risk. And as already mentioned by Dr. Chirico, have a significant ripple effect throughout the entire district. With that, I'll pass it back to Dr. Chirico.
Thanks, Ms. Samantha. And now we'll have Andrea McClellan give us an update on our vaccine rollout.
Thanks, Dr. Chirico. Good morning, everyone. As of yesterday at 3 p.m., we are now at 76% of individuals 12 years of age and older who have received at least one dose of COVID-19 vaccine, and 62.3% of individuals 12 years of age and older who are fully vaccinated. Additionally, 60.5% of youth 12 to 17 years of age have received at least one dose of COVID vaccine, and 34.5% have received both doses. As of yesterday at 3 p.m., a total of 158,290 vaccinations have been provided in our district. Since Monday, we have made a slight adjustment to our dashboard to include individuals 12 years and older in our vaccination totals. This aligns with Public Health Ontario's reporting of vaccinated individuals. We are now into our second week of offering walk-in opportunities for individuals who wish to receive their first or second dose of COVID vaccine with the convenience of not having to book an appointment. This has been successful in our various clinics throughout the district. In response to a drop in vaccine appointments at our clinics, in response to a drop in vaccine bookings at our clinics, we are refocusing our efforts to a more flexible, targeted approach to reach those individuals who may be facing barriers to attending a mass immunization clinic. Those who had their appointments canceled for next week should have received a call or email from the health unit to rebook their appointment. Alternatively, they can walk into any of our clinics this week. There must be a 28-day interval between your two doses of COVID-19 vaccine. We continue to plan various strategies to target groups of individuals who may not be able to attend regular clinics, and will slowly move away from the mass immunization clinics as more individuals get vaccinated. And now I'll turn it back over to Dr. Chirico.
Thanks, Ms. McClellan. So that ends our remarks, and we'll be happy to take some questions, try to answer as many as we can. And if we don't have answers, we'll try to get back to you for sure with an answer. So please put your questions at the left of your screen and attach your name if you can, and I'll turn it over to Catherine to ask the first question.
Thank you, Dr. Chirico. Our first question comes from Eric Tashner from CTV News and is for Andrea. How successful have the walk-in vaccination clinics been? How many of the allocated vaccine meant for walk-in patients have been administered?
Thanks for that question, Eric. I feel our walk-ins have been quite successful. At our Memorial Gardens clinics in North Bay, roughly 150 people per clinic have been able to walk in and receive their vaccine. We haven't specifically allocated a number of doses for walk-in patients because our numbers are low in our bookings. The walk-ins are being accommodated through the vaccine that was allocated to that specific clinic initially. So it hasn't impacted us having to have another allocation of vaccine available.
Thank you. We have another question from Eric Tashner from CTV News. Ontario's Chief Medical Officer of Health says the Delta variant will continue to impact residents until about 90% of people are fully vaccinated. Is it realistic to expect 90% of people to get vaccinated when some are choosing not to get vaccinated? Perhaps Dr. Chirico, you'd like to answer this question?
Sure, that's an excellent question, Eric. And I think that what it really highlights is the fact that it's going to be really important to work as hard as we all can together to get as many people vaccinated as possible. Whether we reach the 90% is solely going to be dependent on people willing to become vaccinated. And I think that what's important to know too is that these vaccines are so effective against serious illness and hospitalizations and deaths. And when we're looking to the future, we're looking to try to get back to some semblance of normalcy, then I think that it's really important for people to strive to get as many vaccinations as possible, up to 90%. Whether that's going to be achieved, only time will tell. And the other thing too is that with school opening in the fall, we want to try to protect our children as best we possibly can. As we know, there's no vaccines currently authorized for under 12 years of age, which may come in the fall. But until then, I think that we also have to remember that the best way to limit the spread within schools and not to have school outbreaks is to keep our community transmission low. And the best way to do that is for everybody to get vaccinated. From our perspective, from the health unit, we are going to work as hard as we can to and make it as easy for people to get us vaccinated and remove barriers so that we can shoot to achieve as high a vaccination number as we possibly can. So thanks for that question. It's really important.
Thank you. Our next question is for Andrea from Chris Dawson at Bay Today. Have you secured another vaccination center facility in North Bay as the garden or Memorial Gardens will close in early August? You're on mute, Andrea.
My apologies. We will be at Memorial Gardens until approximately mid-August. We do have a definitive date that we need to move on. Our plans right now are to start shutting down the mass immunization clinics and moving towards some of the more targeted efforts through pop-up clinics, mobile clinics, and moving throughout the district to try and provide immunization to people who maybe face barriers receiving vaccine through mass immunization clinics. Our planning and evaluation team is pulling together some information that shows us where some of those pockets of lower immunization coverage rates are, and we want to target some efforts at those locations initially. Having said that, in the event that we do need to do larger clinics, 400, 500, 600 individual clinics in the North Bay area, there are options available to us throughout, including locations we've used in the past for our flu clinics. So we're not concerned about the ability to be able to continue to provide larger scale clinics in the event we require them, but we are pivoting to start looking at more of a pop-ups and mass immunization clinic pop-ups and mobile clinic focus.
To continue in that thought, Andrea, Sarah Bissonette from the North Star is asking, I hear that in Parry Sound paramedics are setting up pop-up clinics near shopping coffee areas. How successful are pop-ups? Do people really get vaccinated in a spur of the moment decision?
Thanks for that question, Sarah. Great question. And the paramedics in Parry Sound did an amazing job with the mobile clinics that they ran the other day. I actually was in Parry Sound and saw how it was working. And so because the clinic at the Bobby Orr Center had a fair amount of vaccine available because we weren't fully booked at that clinic, the paramedics in consultation with Katie Hogue, who's leading this clinics in Parry Sound, made the decision to go out to a few locations. And so they went to the Starbucks for an hour. They went over to the No Frills parking lot. They were downtown, and it was downtown where I saw them. And they were pulled out over on the side of the road. They had the flashing lights running with the on the paramedic truck, and they were just stopping people and asking them who were walking by, hey, have you had your vaccine? Do you need a vaccine? We're here to offer your vaccine if you want it. And I actually saw 4 people get their immunizations at that location. They thought it was great. Several of them had said, you know what, I haven't had a chance to get there. This is awesome. You're here. I'm going to get it now. And so they were immunized there, stuck around the area to be monitored just to make sure they didn't have any side effects, and then continued on with their day. So I do believe they can be very successful and are definitely a great way of getting to people where they are.
Thank you, Andrea. Our next question comes from Joey Russi and would be for Shannon and perhaps Dr. Chirico. At the start of the pandemic, we were hearing about long-term effects from contracting COVID-19. Is the health unit aware of anyone who has contracted virus suffering from long-term lingering symptoms?
Well, I could start if you'd like, Shannon.
Sure.
Certainly, it is a well-known entity, and many of them are referred to as long haulers. Typically, they may, a significant proportion of those that do get the symptoms have sort of chronic fatigue, as well as some shortness of breath that may linger. While public health does not do acute care medicine, we don't see these patients, and so most of that would be better directed at the acute care system and family doctors, primary care that look after them. But many of the studies are showing that yes, and I don't see any reason why we would be excluded from that. As far as I'm sure there are people within our district that have had COVID-19 that are experiencing those kind of side effects. Anything you want to add, Shannon?
No, I think that's great. That's we don't follow clients, past when we discharge them from isolation and when they've recovered. And so I know there's lots of studies going on provincially, internationally related to this. So I think that for local information like that, probably primary care and acute care would be the best to follow up with.
And I think it underlines, the reasons too that, some people think, well, most people don't get sick with COVID-19, but there can be significant, long-term effects, and we don't know the extent of it yet, and more studies need to be done. However, getting the vaccination is your best protection, certainly against COVID, and following the public health measures.
Thank you. Our next question is for Andrea and Dr. Chirico. Michael Lee from the North Bay Nugget is asking, to date, about 24% of eligible residents have not received a dose of COVID-19 vaccine. How much of that is due to vaccine hesitancy, whatever the reason may be, or from barriers? Could you expand a bit more on what barriers unvaccinated residents are facing?
Sorry, I can start with that question. So 24% of the population in our district have not been immunized. Some of those people face barriers such as being unable to attend a clinic. Perhaps they work and they aren't able to leave work to attend a clinic, or they have, young children and don't have somebody to watch their children. A variety of different reasons like that. Additionally, a large number of that 24% is in the younger age groups between 18 and 45 to 50 years of age. Part of it is misinformation, part of it is vaccine hesitancy, and there's also a group in there that they're not going to be immunized no matter what information or what barriers we try to remove. They just don't believe in vaccines and they're not going to be immunized. So moving away from mass immunization clinics gives us the opportunity to try and reach people where they're at. Mobile and pop-up clinics are a key example. If you can put up a pop-up clinic in a grocery store, you might get a few people who wouldn't otherwise have been immunized. So you don't immunize the large numbers of individuals in pop-up and mobile clinics that you immunize in mass immunization clinics, but you get at the people who want to be immunized who maybe can't get to those clinics. So you have to use a variety of strategies to reach those people, and that's what we're trying to do as we try to target as many of that last 24% as we can.
Thank you. And in the same train of thoughts, we have a question from Eric Tashner from CTV News asking if COVID-19 vaccine information, is COVID-19 vaccine and misinformation the hardest thing for the health unit to fight when launching vaccine strategies like One Step Closer campaign, for example?
We want to make sure that the proper information is out there and people have accurate information. There's so much information out there on the internet, and in all kinds of locations, and people have to know how to tell if the information is legitimate, evidence-based information, or whether it's just assumptions and misinformation. So that is one of the challenges that we face on an ongoing basis, and our call center and our staff at our clinics do an amazing job of addressing those questions and helping people to get the correct information so that they can make an informed decision as to whether or not they're going to be immunized.
Yeah, and I really think it's important for people when making decisions and looking for information to go to credible sites that from trusted organizations. And that is the best way to get the information that they need to make informed decisions.
Thank you. Our next question is for Shannon and Dr. Chirico from Chris Dawson at Bay Today. The North Bay Battalion released its schedule. How will this look like for fans? Are you looking at a specific number of fans you will permit once the season starts? If so, what's that number?
Well, I could start with that. It really is going to depend on what the province decides. They make the decisions on what's going to be open, and they set the limits on these numbers. So we can't really determine that at this time.
Thank you. Our next question comes from Brad O'Bay from Moose FM and is for Dr. Chirico. The Ontario government has said that the final step of its reopening plan can't begin until at least 80% of those 12 and older have been partially vaccinated. Locally, what are ways the health unit is looking at reaching those goals, specifically if that goal jumps to 90% due to the Delta variant?
Yeah, that's a great question, and that is exactly what Ms. McClellan was talking about. As with the pandemic evolves, as we see what has changed with our vaccine rollout and the declining numbers in mass clinics, now our shift is going to be to targeted areas, targeted populations to try to get those numbers up. And that's exactly what we're trying to do. And through many initiatives, like you saw and Andrea explained, in Parry Sound, we'll be doing similar things here, outreach to these specific groups to try to get the numbers up. Again, what we're really trying to do is impress upon the public the importance that we're all in this together, and we all have to make decisions that are going to affect one another. So we need to keep the numbers down of cases by following public health measures, by doing risk assessments, and most importantly, getting vaccinated. So it's really going to be up to the public to reach these goals. We will make every effort to have ease of accessibility to the vaccines, but people have to want to be vaccinated, and we'll do whatever we can to see that happens.
Thank you. Our next question is for Andrea from Sarah at the North Star. When is the last masked clinic in West Parry Sound?
Hi, Sarah. We are currently finalizing the schedule for August, but it will be in late August. We haven't determined the specific date yet, but it will be in late August.
Thank you. Our next question is for Dr. Chirico. The Ontario Science Table issued a report this week indicating a return to the in-person school as essential, bearing catastrophe. Also, a return to extracurricular and sports are also highly recommended. Do you agree? And this is from Greg Estabrooks.
Yes, thank you, Greg. That's an excellent question. And yes, I do agree. It's been our stance from the beginning of the pandemic, how important in-person learning is to the social, mental, and physical well-being of our children. And certainly there's been tremendous interruption in that. So yes, I do agree with that. We've worked very hard, and our school boards in our district have been phenomenal in partnership and putting things in place that so far we've seen a great response to everything that we've asked to be done, and we haven't had an outbreak in the school to date, and we continue to work with the schools to ensure that we get as many people vaccinated, get as many children vaccinated, as many staff vaccinated, all of the cleaning, disinfection protocols are in place, that ventilation is adequate, and that masking, physical distancing when appropriate, all those things are being followed. So I do agree with the science table that it is very important, and that again, they also mention in that article about community assessing the risk at the time, assessing whether there are low or moderate or high risk within the community, and that's something we can do something about. So if we're seeing really high number of cases, we're seeing high hospitalizations and or deaths, that is something we have to certainly consider. But we can do something by following the public health measures, by getting people vaccinated. That's going to reduce the risk to our children. And so, yes, it's very important to get the kids back in-person learning and with the extracurricular activities. I think it is really important, and we can really make a difference.
Thank you. This marks the end of our press conference. A reminder that the recording will be posted later today on our website, and we will see everyone next week. Thank you, everyone.
Thank you.